Okay, and today we got Mayor Pro Tem, Dave Martin, Chief Pena, Dr. Purse, who with us today. Today, the Houston Health Department reports 267 cases of COVID-19, bringing Houston's total to 70,064. So that's 267 positive cases. Of the 267 cases reported today, 43%, roughly 115, have specimen collection dates within the last 14 days. We also have 7 newly reported deaths, unfortunately, bringing the city's total to 998. We are only 2 deaths shy of reaching a grim milestone with 1,000 COVID-19 related deaths in the city of Houston. And as you can see, those deaths cover some in July and some in August, but none of those 7 are in the month of September. I also want to share the sad news of another City of Houston employee who passed away of COVID-19. Richard Sable was a City of Houston employee who started in 2010. So please keep his family and former colleagues in your thoughts and prayers. Since the start of the global pandemic, the city has lost 7 municipal employees and 3 firefighters. Yes, if you take a look at all of the individuals, these are city employees who have lost their lives as a result of COVID-19. Certainly want to acknowledge their dedicated service and commitment to the city of Houston, and we want to lift up all of their families, relatives, and friends. The virus continues to be a threat to people in our city, whether you're a city employee, just any person that's living within our city. We will continue to monitor the numbers for this month and next month in October. The city of Houston's numbers are better overall, and that is because we have encouraged people almost every day to take the virus seriously and to do their part to stop it from spreading. We are also taking a cautious approach rather than an aggressive approach, as I indicated to you about a week and a half ago, as we deal with how we move our city forward. And we want to move our city forward, but we also want to do it in a way that will not only slow down the spread and contain it, but to crush this virus. For instance, last week we announced a limited number of special events that would be allowed if they follow the health and safety guidelines set forth by Dr. Purse and the Mayor's Office of Special Events. As an example, the Houston Symphony is holding its event at 25% capacity. And if you notice, the Jones Hall can hold up to 3,000, but I think they're only permitting about 150 persons at the Houston Symphony, and I want to thank them for that. I had the opportunity to listen to the governor's remarks today using the hospitalizations as a determining factor for the spread of the virus. I know he is allowing restaurants, retail establishments, gyms, and others to open at 75%. That is a little bit more aggressive than I would prefer in announcing the next round of reopenings for restaurants, retail stores, office buildings, manufacturing facilities, gyms, and exercise facilities, museums, and libraries. And this is especially so because we are right now in the midst of approaching the flu season, and many of our kids are returning to school at certain levels. Those learning virtually will soon be in the classroom in a matter of weeks. The state has taken an approach that comes with high risk, and again, a little bit more aggressive than I would prefer. The governor is only utilizing the hospitalizations as the primary matrix to make decisions about reopening, and hospitalizations, bear in mind, represent a lagging indicator. It's also, let me just say that I look at the TMC's analysis every single day. Today, they did not post the effective reproduction rate that gives you some sense of community spread within our city, within the 9-county areas. So, for example, if the reproduction rate is below 1%, it means that the community spread has slowed down. If the reproduction rate is greater than 1, that means that the community spread is very much in our community. This morning, they did not report a reproduction rate at all. And I think because of the Department of State Health Services is updating its data so that reproduction rate was not included. That is important in determining the level of community spread from their perspective. But let me just say this. We have been here before. Our hospitalizations were low at the end of April, but then those numbers shot up dramatically, and the results were horrendous. Houston is still reporting too many positive cases and death at a level higher than March, April, and May. And going back to March, we had about 1,500, a little over 1,500 cases, as you can see on the sheet, on the screen. In April, that number was 3,200. In May, it was roughly 3,800. In June, it went up to close to 13,000. In July, it was over 26,000, and the number goes on and on. So in March, April, the numbers of hospitalization was low, and we reopened quickly. And then if you look at the number of reported deaths in the city of Houston, in March, that number was very low. And then in April, that number was 106, then in May, 89, in July, as many as 435. So the numbers went dramatically up. And so it's my hope that it will not, what we saw that happen in May when we reopened as quickly as we did, will not happen again. But I would caution anyone from claiming any sort of victory over this virus. This virus has not gone anywhere. This virus is still within our city. We still need to take this virus very, very seriously. To the extent we come together and we don't wear our masks and we don't engage in proper hygiene, again, this virus will remind us that it is very much present. So even though our numbers are much better than they were, for example, in June and July, even in August, our positivity rate is better. We reported at the beginning of this week, our positivity rate was 6.1%. But the goal is to get that positivity rate to 5 and below, and not just to get there, but to keep it there. That's the goal. We are not at 5% and below. It hasn't been at 5%. We haven't been there, and it stayed there for at least 14 days. And so let me just put forth a cautionary note. As much as we all want things to move forward, to get back to normal, we are still not in normal times. And I would urge Houstonians to continue to follow the proper medical protocol, to continue to get tested, and then to be very mindful of your behavior and your conduct, which could lead to a greater community spread. We have come too far since we reopened the first time, and far too many people have lost their lives. Far too many people have lost their lives. Far too many people have gotten infected with this virus. And now as we begin to approach the flu season, and our kids are starting soon to go back to school, this is not the time to take an aggressive approach in dealing with this virus. Let me pause there and bring up Dr. Peirce.
Thank you, Mayor. I have a couple of thoughts to share. One is that earlier this week, we reported the positivity rate of 6.1. Keep in mind that that is based on a very small amount of data from the previous week. And as we get more data coming in, what we've seen in the previous weeks from that is that the number tends to bump up a little bit. So while 6.1 is good, and we've said the numbers are coming down. But as we look towards 5%, remind everyone there's nothing magical about 5%. So as the mayor says, once we do get to the 5%, we need to keep on going and get it down lower. And again, I challenge Houstonians, since New York City is at around 1%. If New York City can do it, certainly Houston can do it. So we have a lot of work to do. That also, when we start talking about percentages, and the governor's statement today, he talked about hospitalization, the percent of patients who are hospitalized, and that with COVID, what percent of the hospitalized patients are diagnosed with COVID. And that's going to be used looking at the trauma service areas. And so the state of Texas is divided up into 22 trauma service areas. And for this region, it's a 9-county region, and each one of those is lettered. We happen to be trauma service area Q, as in Quebec. And for our 9-county area, the current for all hospitalizations is at 6.9%. So that's and it's way down from what it was. So again, the numbers are going down. The governor talked about a 15% threshold. We're way below that. My concern is that we need to keep that number going down. And if it changes direction and starts going up, depending on how quickly it goes up, we'll have a lot of time to know before we get to that 15%. And so I'm a little curious as to what's going to happen between 6.9 and 15%, what we're going to do as a community. But what I would like to think is that we never find ourselves in that situation. We have certainly learned that by wearing masks and social distancing and doing all these other things, that they work. They really work. There is no vaccine. What is changing the numbers today is the behavior of Houstonians and all of our friends and neighbors in all of Southeast Texas. And so as we continue to do these things, this is what empowers us to protect our community, and that isn't going to change. We have to continue doing that. So even though the governor has made his announcement today, that doesn't change the way the virus behaves. It doesn't change how it will take advantage if we drop our guard. So let's not drop our guard. Let's keep it up. Let's fight the fight, and let's crush the virus.
Chief Pena.
Thank you, Mayor. So for the fire department, we also continue the positive trend downward for our quarantine of personnel. Today, we are at 43 firefighters that are in quarantine. We have 26 that are positive for coronavirus. They're all recovering at home. In regards to our occupancy task force, with the opening up of gyms and restaurants and other businesses up to 75%, we anticipate our call volume is going to go up for complaints. Please bear with us. We do know that the calls are going to come and they're going to go up, because 75% occupancy doesn't look much different than 100%. So we're going to be, we anticipate being busy, but the Houston Fire Department is going to continue to be a resource to these businesses to ensure that we're doing the right thing in meeting the intent of the governor's executive order, and we're providing a safe space for people to attend these businesses. I would recommend, as the mayor has emphatically stated, that we maintain wearing our masks, physical distancing, and proper hygiene. That's really going to be what's going to help us achieve our goal. And it is the best recommendation we have at this moment. So with that, that's my report, Mayor.